Welcome back to JMRight Academy. I hope you're all ready with the answer for the last class question. The last class question was, what are the various resources available in order to obtain the drug information? The source of drug information is pharmacopoeia, and you have various pharmacopoeias like Indian pharmacopoeia, British pharmacopoeia, European pharmacopoeia. And this will be a book for complete standard reference for manufacturing of drugs. Okay, this will give about the standards of purity, the chemical entity of a drug, and the potency of a drug. So you can obtain the manufacturing standards from pharmacopoeias, and the latest edition of is for Indian pharmacopoeia is 2018. And you have various formularies. So from the term formularies, complete drug profile, you can find each and every drug with their dose, indications, special precautions, warnings, and dosage forms, and dose for adults and pediatrics. These are all the information you will be getting from formularies, and you have National Formulary of India and British National Formulary. So National Formulary, the latest edition is 2016. And similar to formularies, you have physician desk reference, SIMS and MIMS. So the current index of medical specialties, and MIMS is monthly index of medical specialties. So this will be, MIMS will be published every month, and SIMS will be published every 3 months. So the only difference between the national formularies and SIMS, MIMS and physician desk references, the various same drug will be manufactured by different brands, so different companies, and those brands and their formulations, their strengths will be included in these SIMS and MIMS, and that will be updated every month and every 3 months once. So only the additive information is the brands and the strength information and the formulations available. The next, moving on to the today's topic, which is different routes of drug administration. So you can think, why are you teaching this? You can directly go to the drug, about the drug information. You can directly go to CNS drugs and cardiovascular drugs, but as you are all future doctors and you are all future clinical pharmacists, so you must know about the different routes of drug administration. So let's move on to the topic. So you will be seeing about 3 routes of drug application, that is routes of administration. One is local application, the second one is oral route, which is also said to be enteral route, and the third one is para-enteral route. So these 3 will be seeing in this class. So local application. So local, in order to obtain the local effect, in order to obtain the immediate local effect, you can use gels. You will be knowing gels, creams, ointments. So these are all the examples for local application, that is candid dusting powder, mupirocin ointment, salbutamol inhalers, that is you will be having a local effect. And apart from this, you have pessaries. Pessaries are the drug formulation which are injected into the vagina and rectum. So these formulations will be used then and there in order to produce the local effect in those rectum and vagina. And you have, apart from these formulations, you have evacuant enema and retention enema. So enemas, you will be knowing about enemas. So enemas are liquid formulations in which will be injected into the rectum. So basically you have 2, that is evacuant and retention. With the name itself can know the difference between these 2. So evacuant, that is evacuation, removing out, in order to remove the fecal matter. So these enemas are used. Usually soap and water enemas will be used as an evacuant enema, and this is retention enema. So retention enema is nothing but retention, so retaining the drug inside the rectum for its local effect in the rectum area. So for example, I think you know about ulcerative colitis. So ulcerative colitis is nothing but a inflammatory condition. So inflammatory condition of majorly affecting the rectum. So in order to produce a local effect, these retention enemas are used, and example for that is retention enema of prednisolone. So this will be used in ulcerative colitis. So moving on to the oral or enteral route. So oral or enteral route is the most commonest route. You will be knowing these. So oral or enteral route. So enteral, that's intestine. So which goes into the intestine. So you have various formulations. I will be telling about this will be interesting. So you have apart from, you will be knowing about tablets. Apart from tablets, there are enteric coated tablets, sustained release or delayed release tablets. So enteric coated. So enteric is this prevents the gastric irritation. So the patients who have gastric irritation, the enteric coated tablets will be used. And you have sustained and delayed release tablets. So if you want the patient to take drug only once daily or twice daily, and you have the frequent dosing should be avoided, and you also must have the continuous effect, you can use this sustained release. That is, the drug will be released slowly from the formulation. So that are said to be the sustained release tablets. And you have, apart from that, you have sublingual, that is lingual, it's the tongue, under the tongue. So one of the major example is nitroglycerin, which is used in the treatment of angina. So it produces an immediate effect. So that produces by vasodilation, that is dilating the vessels. Nitroglycerin is used as a sublingual tablets. And you have buccal administration, which will be placed in between the gut and the inner line of the cheek. These are the oral or enteral route. So moving on to the disadvantages. Okay, before going to the disadvantages, let's see about advantages. So what may be the advantages of oral route? You can guess very easily. It's economically feasible when compared to the injectables. And when compared to the injectables, it can be self-administered. So these are the two advantages you have with oral administration. And with disadvantages are, so you can easily find out. So patients who are you have nausea or vomiting, oral administration is of no use. And for unconscious or emergency patients, definitely not. And one more thing, this is an important issue. Some drugs will be destroyed by the digestive juices, and they are not prepared by oral forms. So one of the major example is insulin. So insulin gets destroyed by the digestive juices. That's why insulin is given through injections, not as not through oral route. So next one is one of the major disadvantages is irritable. So if the patient doesn't want to take the irritable drugs, or if the taste of the drug is bitter, oral route can be avoided. And in case of emergencies, the oral route doesn't produce an immediate onset of action. It takes time. So in such cases, it's not preferred. So moving on to the para-enteral, that is apart from the enteral route, apart from the intestinal route, the other forms are said to be the para-enteral routes. So examples are the major two routes are inhalation and injectable. So let us see one by one. In inhalation, you have various inhalers like metered dose inhalers. You have I've seen patients using the inhalers. So most of them will be using metered dose inhalers. So the patients will be pressing the inhalers. With the pressure, the drug canister, the drugs will be injected, and this is how it is used, and that will be activated. Whereas dry powder inhalers. So dry powder inhalers are nothing but you have those will be you have dry powder inside the inhaler that will be activated only when the patient inhales. So those are said to be dry powder inhalers. Apart from that, you have nebulizers. So nebulizers is you will be having the liquid form of drug inside that nebulizer, and that liquid form of drug will be converted into mist that will be inhaled into the lungs by the patient. So these are said to be the nebulizers. And injectables. So these are the three inhale forms, and apart from that you have gases too. And injectables. Moving on to the injectables, you have various forms in injectables. So let us see one by one. So injectable technique. So intramuscular. So intramuscular is This is the route which is used in case of solutions, or in case of if there is mild irritants, it's okay to use intramuscular route, and comparatively have a good absorption rate, that's why it's used here. And apart from that, you have subcutaneous route. You can see the picture. Subcutaneous route is above the intramuscular layer, that is the subcutaneous route, and the drug solution must not have any irritants in case of this route. Okay, so the most commonest example is I've said about one drug in digestive juices, insulin. So insulin is administered subcutaneously. And next one is intravenous route. So intravenous, it's the most common route other than oral route. So intravenous route is the route in which the desired concentration of drug, if the doctor has a desire to achieve a certain concentration in the blood in order to save the patient, intravenous route is best route. So that routes are mainly used in case of emergency. And the main disadvantage is it's not self-administered, okay, when compared to oral administration, and local irritation will be there, and this cannot be, the therapeutic response of the drug cannot be immediately reversed because it will be directly entering into the blood. So immediately the therapeutic response of the drug cannot be reversed in case of intravenous route. Next, moving on to the intradermal route, it's the top layer, that is epidermis part. So before injecting into the intradermal, the test dose must be administered, only then the intradermal route can be used. One of the basic example is BCG vaccine. So they will not suddenly inject the BCG vaccine, they will use the test dose and they will see any local irritation, and then only they will administer the BCG vaccine. So this is one of the example. Next, moving on to intra-arterial route. So arteries, injecting the drug into the arteries. So it's mainly used in diagnostic purposes, like in case of angiograms. So next one is, apart from that, you have intrathecal, intraperitoneal, and intraosseous. So intrathecal, you can see the picture, the spinal cord, that is the space in between the spine and spinal cord is the intrathecal space, and this is mainly spinal anesthesias will be injected through this route. And intraperitoneal route, so peritoneum, peritoneum is the space, so inside this abdomen you have this peritoneal space will have a larger surface area, so it is easy, when there is some larger surface area, it will be easy for absorption of drugs. So basically it is used in infants in order to achieve a faster absorption, in order to give IV fluids and glucose. Next is intraosseous. So intraosseous is in case of severe shock, it's usually injected into the bone marrow using a special gadget. Okay, so it will be used in case of severe shock or cardiac arrest. In case of emergencies, in critical conditions, this route will be used. So that's all about drug delivery system. One of that is novel drug delivery system. You can find out that. Stay tuned. Have a nice day, and you can visit the JMRight Academy website that is given below. And thanks for the huge support. Thank you. Have a nice day.